Come. Come.
Working in the remote areas of the city.
This dog has been having otitis, so I took an ear swab, that is a sample, to the laboratory for some tests on to determine the bacteria which is causing the infection. Otitis is ear infection. So after the lab results were out, they determined that the bacteria inside the ear, which is causing all this infection, you can see there have been some serious wound. We had done some cleaning. So today I'm coming to do a serious a thorough cleaning in the ears. I will be doing a thorough cleaning, and also I will leave some ear drops, the recommended type of antibiotic ear drops that will heal him. So the reason I'm sedating him is just to make him calm, and maybe the ear washing process, sometimes it's really painful. So I want him not to be that stubborn, and also to relieve some pain on him when I'm cleaning the ears. So let us just wash the ears, nothing else. I'll be cleaning and giving some antibiotic shots, the recommended antibiotic, and the ear drops. When there is an infection in the ears, you happen to get a lot of pus or waxation, a lot of waxing. So this comes as a result of pus, is a result of the infection, and the wax comes as a protective measure taken by the ear. So you can see there have been some damages. These are, you can see the red, almost the blooding. These are wounds caused by the infection. Yeah, I think my finger can't stick in the ear, so you can see it's a very dirty. Ear inside. We will be doing this on both ears. This is a common thing, especially in Mombasa, or areas where humidity is very high and associated with a lot of German Shepherds. Although you might get it in other breeds, but very common with German Shepherds. What I would really advise you guys who keep dogs, if you happen to get such a condition, you should never ever try to do any medication without assistance of your vet. Because if you happen to put any antibiotic in the area, it's a very sensitive area, you can see, and very hard to clean. So you might cause, if you happen to cause a resistance in the wounds, you might really get a lot of trouble while treating the condition. And maybe if in case of a resistance, you might cause your dog to permanently live with the condition. So never ever try to put any antibiotic or any medication unless it's prescribed by your vet. And mostly the best way to treat this is first of all take an ear swab to the laboratory. Be sure of the bacteria you are dealing with. This is the advice to the vets, and now you will be good to go. You won't get a lot of problems after that. As a vet, you should know the test. You should know the test which you should run in the laboratory. And the good thing with the lab, they give you the specific bacteria and the antibiotic that we respond to the antibiotics that responds to them. I'm feeling we are done here with this one, Well, let me first of all check that are clean. That's basically a disinfectant. We'll be disinfecting the wound. And then later on cleaning them. That is flushing. We're flushing all the wounds. And I don't think this dog should have any issue with the same disease at all in any coming future. I didn't have any infection in this year, but it's starting. Last time I was here, there was no infection, but it seems it's starting. You can see some pus. Yeah, so we'll do the same procedure. First of all, cleaning. I've not yet applied the recommended antibiotic. You can see the pus. Yeah, it's infected too. This is one of the most common conditions we get here in Mombasa, especially with German Shepherds, as I said earlier on. Very common. I think a month I have to get more than 3 cases, 4 cases. So you can see I have already sweat and my hands are already wet. This is one of the reasons I really don't like working with the gloves, because as you can see, it will be now a true tragedy for me to work with these gloves, so I will have to get them off. I'm almost done with the work here. I'm only just putting the antibiotic inside. You can see here in Mombasa it's really hard working with gloves. Unless it's a very serious case, which I need to be extra careful. I think I rarely use gloves so that I can get the grip I want. So the eardrop we got it's in form of eardrops. So this will be done twice in a day for the next 5 days. So we'll have to let it soak inside. He's feeling agitated. The fluids inside the ears. So I'm going to do the same on the other ear. No. Dogs can really get stubborn. This is the reason I was sedating him, because I did it what all this. He's not a very bad boy, but he would really be stubborn when we are working, and we are working on that. So that's the reason we can see us. We have to sedate them before doing this to them.